Exciting news. Texas Health Presbyterian Hospital Dallas is the first hospital in Texas and one of only 3 in the country to be named a Center of Excellence for Women's Surgery by the American Institute for Minimally Invasive Surgery. That is good news. And OBGYN Jay Staub is here with more. Dr. Jay, how are you?
I'm great, thank you.
This seems like such an honor for the hospital.
Oh, it is, and we're very excited because we're able to offer women choices that they haven't had up until now. We're able to do a lot of minimally invasive procedures that allow them to recover with less pain, to stay in the hospital a shorter period of time, and to get back to work more quickly.
And what kind of procedures are we talking about, and what are you being recognized for?
Well, we're recognized for our commitment to procedures for women, laparoscopic procedures such as hysterectomy, removal of fibroids called myomectomies. We treat endometriosis, which is very common. And we're using laparoscopic techniques which allow us to have 3 tiny incisions, one just below the belly button, 2 down low near the pubic bone, and through those small incisions we're able to do all that we need to do to get them out more quickly.
I'm sure as a doctor this really impresses you that this kind of technique has happened while you are practicing.
Oh, I'm real excited about it. We're able to give women a choice. They are very excited. I had a patient recently go back to teaching 4th grade 1 week after her hysterectomy.
Wow. And that's a demanding job, and she was able to go back and feel pretty good. That's
I'm not
great.
sure I was real excited about that for her, but she was excited about it.
I'm sure as a doctor that worries you, but it just goes to show how great these procedures are. Well, let's focus on what Texas Health Presbyterian Hospital excels at, and that's the hysterectomies.
Well, what women don't realize is that hysterectomies are the 2nd most common operation done on women after C-sections. Approximately 800,000 women have hysterectomies each year. By the age of 60, 1 in 3 will have had a hysterectomy. And most of the time, these are done, historically at least, with big abdominal incisions requiring 3 or 4 days in the hospital and a 4 to 6 week recovery. At Texas Health Dallas, we've made a commitment to using laparoscopic techniques which allow them to be out of the hospital sometimes the same day, at the very latest the next day, and be back at work within 2 to 3 weeks.
And why is that such an important option? I assume because of the recovery time that women have that option to undergo minimally invasive surgeries for hysterectomy.
Well, it's important because there's less pain. I've walked in rooms at the end of the day and women are up, joking with their family, eating a regular meal, and say, "Can I go home this afternoon?" So it's really important that we get them back into function. It's a money-saving procedure as well. It saves the insurance companies. It saves work from having to pay for time off. So there's a lot of benefits more than just the procedure itself.
It's beneficial to you as the doctor, I'm sure, and beneficial to the patient, and it trickles down from there, as you see. Well, what's the one most important thing that we need to know about this type of gynecological surgery? Women
need to understand that they have a choice. Historically, their doctors who deliver their babies, they have a very good comfort level with. And the doctors recommend a hysterectomy, and there's no question it's just an open procedure and it commits them to a long recovery with more pain. They need to understand that they've got a choice. Many years ago, gallbladders were taken out with big incisions and required a month to 2 months to recover.
Wow.
And now over 90% are done laparoscopically and people are back to work quickly. And we need to make the commitment as surgeons to get patients back to work more quickly with less pain and less invasive procedures. And that's what we're doing at Texas Health.
Which sounds amazing, because then women are more likely to take care of themselves if these procedures are made easier and recovery time less painful. Then we're going to take care of ourselves and seek the health care we need.
Absolutely.
Okay, Dr. Jay, thank you so much for being here today. And if you want more information about Texas Health Presbyterian Hospital Dallas, you can log on to their website. It's texashealth.org. And for now, we're going to send it back out.